Namaste. Welcome to your prenatal asana series. We are going to practice Virasana, also known as warrior pose. This pose is absolutely safe to be practiced in first and second trimester. In third trimester, as the lower back curves deepen, so specifically in the case of women where the lower back curve is already too deep, we should be avoiding stretching too hard there and not putting any further pressure onto the lower back. If the woman is in normal condition in the third trimester, she can practice this, but we need to keep in mind that she should not be arching her back from beyond her comfort zone. So very slight arch is fine, but is not recommended to do the complete stretch in the Virasana during the third trimester. Also, if there is acute knee pain or pelvic pain or ankle pain, then this can be avoided. Otherwise, this asana is safe to be practiced. This also has slight pelvic opening required. So because this opens the pelvic region, if women is really concerned about her pelvic conditions like placenta previa or cervix stitch, in that case also it can be avoided. Otherwise, it's safe practice to be practiced in other conditions. So just keeping in mind not to overstretch at any point in time. In the third trimester specifically, one can overstretch the abdomen muscles without being aware of it, as the belly has already stretched to its extent. So sometimes a stretch which is unconscious or not given enough mindful time and space while stretching, if that is the case, then it can unconsciously stretch the lower muscles underneath the abdomen muscle, and so hence causing pain specifically in the third trimester. So just keeping in mind, entering into asana with a lot of ease, staying there with a lot of ease, and with complete mindfulness with breath is important. Now, this asana actually helps you open your pelvic area, allows the hip joint to loosen up. It stretches our legs and hence helping in any fluid retention or leg cramps. And it also gives a good stretch to the hamstring muscles, to the calf muscles. It also is one of the balancing asana. So just like any other balancing asana, it allows our nervous system to regulate itself. It allows an opportunity for our nervous system and muscular skeleton system to just create a coordination among them, and hence enhancing the capacity of the nervous system. And because we are giving a good stretch to both lower body and the upper body, it also helps us improve the digestion. So this has many benefits, just keeping in mind certain precautions. So the way we practice this is we take our right leg towards the right hand side and our right feet faces right hand side, and our left feet will go a bit more backward, creating a good stretch in between both legs and nice space. Now we would want to bend on our right leg. Once we have come into this position, we look forward towards the right hand side, and from here we will begin to stretch our arms upward, hence giving a very good opportunity for the upper back to stretch, to shoulders to stretch, our arm muscles to stretch. This stretch will also open up our ribs area, hence creating some more space for the baby. Also, breathlessness is a very common phenomenon during the pregnancy. It can also ease with that. But being careful with the fact that in the third trimester, we do not want to overstretch or overarch our back. Even in first two trimester, if the woman is not comfortable in doing the complete stretch, what you can suggest, while she has come into this posture, she can simply place her hand into Namaste and stay there. Otherwise, the complete Virasana is where we gently stretch fully. Look up. Being mindful not to overstretch the rib muscles or the side muscles. Exhaling, coming back to center. This is Virasana, and keeping things in mind is very important. We can practice the same asana on the other side as well. Again, coming into the position, keeping in mind the stretch, not to overstretch the side muscle, either Namaste or a complete stretch. And coming back into center. Being mindful of the breath, guiding each step with breath while going up, while inhaling and exhaling, and once you have reached there. So all this is a very important part of practicing this asana during the prenatal phase. Once even the stretch is there, never to hold the breath, just long and deep breathing and coming out of the asana as soon as it's if it's uncomfortable, immediately. Otherwise, do not ask them to stay for longer period. Just for a few seconds are enough. So once they have gotten a good stretch and taken about 2 to 3 breaths within the asana, they can come out of it with ease. And please being mindful of the side muscles and the lower abdomen muscles, because once it stretches, the pain can last for about 10 to 20 minutes, which is not a graceful experience for any women in the prenatal phase. So being mindful of that is very important while practicing this or any stretching postures. Thank you.